Okay, so I will be doing my diabetes management checkoff. So first thing I'm going to do is I'm going to check my patient's blood glucose. So I'm going to make sure the order is correct, identify my patient, gather my supplies, and head to their room. I'm going to do a quick assessment before I do this. I'm just going to, make sure I identify my patient, explain to them what I'm going to do, assess their readiness to eat, assess for signs and symptoms of hypoglycemia, see where their last insertion site was, any issues with the skin integrity and that kind of thing. Then I'm going to go ahead and wash my hands and put on my gloves. Okay, once I've done that, I'm going to pick a different site than the last site that was used for my patient for their, I'm going to locate the lateral side, the furthest point of the finger to use the lancet on. So I'm going to go ahead, I'm going to clean the site. I'm going to make sure they wash their hands and dry their hands. I'm going to clean the site still with alcohol pad. And then I'm going to, once I've done that, I'm going to kind of fan it dry. Then I'm going to take my glucometer. I'm going to turn it on. I'm going to stick my testing strip into the glucometer. Okay, I'm going to have that ready. I'm going to go ahead and take that clean finger that I just cleaned with the alcohol pad, and I'm going to pierce it with the lancet. So it'll be something like this. Okay, and once I have done that, I'm going to take a cotton ball, and I'm going to wipe off that initial blood. Then I'm going to squeeze again, get some more blood, and I'm going to place it against my testing strip. And that's going to give me my number. So in this case, it'll be 252. So then I'm going to clean off their finger. And yes, so then I'm going to go ahead into my, I'm also going to make sure I put the lancet and the strip in the sharps, because this contains blood, and the lancet also is a sharp and has pierced the skin. So I'm then going to take off my gloves, wash my hands, make sure everything is cleaned up. And I'm going to document also that the sugar was 252. Okay. So now we're going to move into the insulin administration portion. So like I said, it was 252. So it's going to be, according to my computer, my MAR, that's going to be 6 units of regular and 16 units of NPH insulin. So I'm going to remember, of course, when drawing these up, to draw them up clear to cloudy. So I'm also going to keep in mind my assessment from earlier, like has my patient been eating and that kind of thing. I'm going to make sure, and I'm going to assess also for signs and symptoms of hypoglycemia. Also, I'm just going to make sure that these are the correct insulins. I'm going to compare the order with the MAR, and identify the patient. I'm going to explain to the patient what I'm going to do. And then, so I'm going to explain to the patient what I'm going to do. And then I'm going to go ahead and start drawing up my insulin. So I'm going to make sure they're not expired. Make sure that they're right, that they're good to go. I'm going to wash my hands. I'm also going to roll them like this, because you don't shake insulin. So I'm going to bring these to the patient's room. I'm going to explain what I'm going to do, make sure they're eating, all that good stuff. I'm going to wash my hands. I'm going to go ahead and put on my gloves. Okay, so I'm drawing up insulin. You draw it up clear. I'm going to make sure I have my insulin syringe also. It's always going to be the syringe with the orange cap. So when you draw up, you always draw it clear to cloudy. So I'm going to clean the tops of both of these. Okay, and then I'm going to go ahead and inject my air. So I'm going to go and inject the 16 into the cloudy. Okay, and then I'm going to inject 6 units of air into my clear solution. Okay, and while this is in here, I'm going to go ahead and draw up my clear. It's going to be 6 units. All right, so then I'm going to go ahead to my cloudy, and get my 16. And I know that it's going to be about 22 total units that I have drawn up. When I'm done drawing with this medication, I'm going to make sure there's no bubbles. And I'm going to have another nurse verify that it's correct, because insulin's a high alert medication. Once I've done that, I'm going to put these to the side. Then I'm going to tell my patient what I'm doing, make sure that I pick a different site than the site that was used last time. I'm going to clean the site. I'm going to wash my hands and put on some more, wash my hands, put on some more gloves. I'm going to pick like a fatty part of the skin. So like the stomach, the thigh, and the back of the arms, or any fatty part they can get a good chunk out of. So I'm gonna make sure that site is clean. Then I'm gonna go ahead and pinch the skin about 1 inch. I'm gonna go in at like a 45-degree angle. Okay, and once I've done that, I'm gonna immediately put this in the sharps. Once I've done that, I'm going to wash my hands, wash my hands, clean everything up, document exactly how much insulin was given, along with, what the reading was, what my insulins were, how much of them I drew up, how the patient tolerated it. And then I'm going to also just kind of watch them after I gave this, especially since I gave a short-acting insulin. Make sure that their sugar doesn't bottom out or anything like that. And that's it for this video.